Good afternoon.
Good afternoon.
Thank you for visiting the museum today. On this exhibit, I will talk to you about the history and current complexities of the U.S. healthcare revenue cycle. I will take you to a journey from the creation of the chargemasters in the 1920s to the current state of our healthcare billing system when it comes to Medicare and in Medicaid inpatient services. As I mentioned before, the concept of chargemaster emerged in the late 1920s as a measure for hospitals to be able to recover from the costs derived from providing medical care to their patients. Initially, there were only 5 items or services being billed. As time went by, more and more items were added to the list of chargeable items or services. In the late 1950s, hospitals were given the additional task of charging patients for a coinsurance and deductibles under the indemnity insurance program. By the 1960s, chargemasters were used to regulate payments. Before the federal government intruded the healthcare system, healthcare-related costs were a fraction of today's prices. Hospitals' costs did not cost a year's wages, and health insurance was much less expensive and accessible, and much more accessible to virtually everyone. And believe it or not, doctors back then even made house calls. In the late 1980s, chargemasters were continued to be used, but this time they were used to negotiate hospital rates. Healthcare costs continued to skyrocket, and funding shifted away from health promotion and disease prevention to acute care. Today, the inpatient hospital visits initiate the billing cycle, representing the medical services and care provided. The services rendered are included and itemized in the chargemaster, and the care provided is either categorized as self-pay or as a billable item to Medicare or Medicaid. When the item has been categorized as billable, it's included in the Form 8371, the CMS 1450, or the CMS 1500 form, along with the corresponding HCPC CPT codes, revenue codes, or DRGs. This form is later submitted to Medicare or Medicaid for payment, where a series of processes start to take place. The first process is the adjudication process, checking for basic information included in the claim to be accepted for processing. The process continues by confirming that the contracted prices with the institution are correct on the form. Next, CMS checks for exclusions that may have overlooked by the hospitals or the bill, and then it passes it through an eligibility stage, checking to see if the services billed are eligible as well as the time frame in which the bill was submitted. The next step is to determine the discounted price for the services rendered, as well as the allowed amount to be paid based on the patient responsibility on the bill. Lastly, after going through all these different stages, CMS determines whether the bill should be paid or not. And this is the end of my exhibit. Well, thank you for your time, and I hope you enjoy the rest of your day.
Thank you.